I'm Robert White. I'm a council member in Washington, D.C. I chair the Housing Committee, and I've been on the D.C. Council for about 7 years. When I became chair of the Housing Committee, one of the first things I did was started to go around to homeless encampments around the city to talk to people about their experiences and why they were still living on the street. And I experienced one of the most heartbreaking things, which was that almost every single person I spoke to said that they had already been approved for a housing voucher, but they were still on the street 1, 2, 3 years later because there were not enough caseworkers to help them. At the same time, DC was facing a crisis of violence, particularly with young people, and young people kept asking for more mental health supports. But when I looked at our data, I found that we had about 100 open school behavioral health positions. The Pathways to Behavioral Health Degrees Act is a bill that I introduced and passed that created a free master's in social work and master's in counseling program here in Washington, D.C., not only paying for tuition, but books for the exam fee and a stipend for living expenses. The goal was to get more people from communities that needed more social workers into the social worker field and to completely reduce the financial barrier that keeps a lot of good people out of this program. This award means a lot to me. The issue of equity is an issue that so many of us talk about, but what it comes down to often is access. And part of access is affordability. Can people who want to be and would be incredible social workers actually afford to get into the program and pay for the program? And I think once we reduce that barrier, we open up the door wide for people of color, for women, for other communities that historically have had fewer resources to go into this field and to make a tremendous difference there. My best advice for people who want to call on their lawmakers to support mental health is just to call. And to testify at hearings. I have been so inspired by the number of young people, teenagers and people in their 20s, talking openly about mental health, about therapy, and about the need for us to focus on mental health. And the more of these conversations we see, either because you're calling your lawmakers or showing up to hearings, the more we're going to move the ball forward. So there's a generational, a historic shift happening. And if we keep pushing in this direction, talking about mental health, talking about the need for having more social workers and therapists, I think we're going to cover a lot more ground, but we have to talk about it.